Well, I appreciate everyone being here, and I see we have a request about, and those of you who just came on, if you can introduce yourselves in the chat. We do have a request about mental health resources, which I think we'll be talking about some today. This is a meeting we do once a month, and it's just to update you on different things that we're aware of that are going on policy-wise. And this month, well, and one of these was actually at the end of last month, we're going to go over 3 things that happened, and they're kind of policy dense, but we'll try to pull out some things that are most relevant to what families and those working with families are most likely to be working on. So those 3 things are, there was a letter from the federal government, and it's the agency, the Center for Medicaid and Medicare Services. That agency, and this is usually at the direction of the president, sent a letter to all state agencies saying a state Medicaid agency. So our division of Medicaid in Mississippi got this, saying these are some things that we think you should be focused on. So the first thing we're going to do is look at that letter, and we're not going to go through the whole letter because it's 57 pages long. And we will have the information about this in our newsletter this week, which is probably not going to come out till Friday because there's so much information to share with you. But all the links and all that will be in there. But we're going to start with looking at that. And I never know quite what's going to happen when I share my screen, but let's see. Okay, let's look. Okay, so this is some highlights from that letter. Let me see if I can pull up the actual letter too. First, I'm going to put in the chat, this is the actual letter, and then these are the highlights. So there's the link to the actual letter. So these are some highlights from this letter that was sent to all state Medicaid agencies that were saying these are the things that we think you should most work on and that we most want to see. And it starts off by just kind of explaining how Medicaid for children is different than Medicaid for adults. Now, do any of y'all have any ideas about, because sometimes that's a new idea for people. Anybody have any ideas about how Medicaid is different for children than it is for adults? And you can either just unmute or put something in the chat. Or is that kind of a new concept? One thing about Medicaid for children is it's meant to be more aggressive in getting out there and saying, is anything going on with this child that they need help with that we can go ahead and address now so it doesn't get worse? Yes, and it's easier to qualify for Medicaid as a child. I saw someone put eligibility in there than it is as an adult. And looking at what can we do to be really proactive to help children get on the right developmental track and stay on the right developmental track. And that's referred to, sometimes you hear people talk about EPSDT, and it's really not that important to remember what all those words stand for, but what they stand for is early prevention, screening, treatment, and diagnose, or EPS, screening, diagnosis, and treatment. So looking early for how can we prevent things that might be happening with kids, screening them to see how they're doing, providing diagnosis early on, and treatment to get them on the right track. And the whole idea is to find these children, aggressively intervene early so they can get on and stay on the right developmental track. So this letter starts off by reminding state Medicaid authorities of that. And then it goes on and says, and letter uses a lot more fancy words than this list does, but that Medicaid should proactively let families know about the range of Medicaid services available to children because a lot of families don't know. And it talks about ways to reach families and let them know about the services that are available. Now, one thing that we put when we were telling you about this session is that people in this session are probably going to have some of the best ideas about how Medicaid can do that. So for y'all to be thinking about when you look at this list of suggestions, what would you tell that our division of Medicaid about these suggestions? Because you might see some and go, well, that's not going to help, or they need to do it this way, or that's a good suggestion, but it's only going to work if this happens. So as we go through this, we encourage you to think about, and at the end, we'll talk about some ways you can share your feedback with Medicaid. It also says that Medicaid should help families understand and access transportation resource services, that Medicaid's not necessarily the one providing the transportation, but that they should help families understand what transportation is available to appointments and help. And that high quality, conflict-free care coordination should be available to children and families. And what that means is that there should be someone available, especially for children who have a lot of needs, that can help families figure out, well, how do I navigate all these different systems and get the help that my child needs? And this guidance, and remember, it's 57 pages long, so there's a lot of details in the letter about each of these things. And I'd encourage all of you, if you're really interested, to go back and read the letter. Any parts that you're particularly interested in, or the whole thing. It's just hitting the highlights. But that Medicaid should find ways to provide different paths to provide that care coordination. It talks about really practical things. I think we have some peer supporters on here. Like peer supporters might be able to provide that care coordination. It might also mean a community health worker, which right now we don't have those that can be paid through Medicaid in Mississippi, but that's something the legislature is looking at. Those are people in that community who really know the people from that community who can be trained to help provide that kind of care coordination, but that it's really high quality. It's not someone just saying, do you need anything? And that managed care organizations, that they need to be trained to help with this. Does anybody have any idea what conflict-free care coordination is? I used to think that meant that nobody argued, but that's not, when we hope that's true, but that's not what it means. Anybody have any ideas on that? This is a quiet group. I'm gonna have to start calling on people. Okay, what that means, and this is implied in the recommendations in this letter, it means that the person who's helping a family with care coordination doesn't have any investment in where they get the services from. They're not trying to refer that family to services in their own agency, because there can be a conflict there if somebody is. That could mean that, their agency is going to make money off of those services, so they might feel pressured to refer a family just to the services in their own agency. And families should be able to choose their services from wherever they want. So there has to be a way to make sure that anybody who's helping them with care coordination doesn't feel pressured by their own agency to refer families to services just from their own agency. There's different ways to do that. One is to have care coordination in a separate organization than organizations that provide services, or it can be dividing those things within an agency and making sure those two sides don't try to influence each other. So that is implied in how it describes care coordination. So families should always have a choice. This is really, really important in where they get services from, and they shouldn't feel any pressure to pick services from the same agency that they're getting their care coordination from. I think we have some providers on here. This may apply more to you, Managed care organizations and Medicaid cannot use prior authorization to delay children from getting the treatment they need. And prior authorization is when, let's say, a child needs a service, and whoever wants to provide that service has to call the managed care organization or the insurance company and say, is it okay? Are we approved to do this? And sometimes that really delays treatment. It delays what that child needs. And in this state, we're seeing that, I think we still are, with wraparound care coordination, which is one of those high quality conflict-free care coordination models, so that cannot be delayed. States have to figure out a way to do that. And probably what the solution is instead of saying, we're going to wait and see if we approve this, is to go ahead and start offering the service, and then the managed care organization can come back and look and see, does it look like that was really necessary? And to make sure of that. Any questions about any of these so far? All right. This letter also says that managed care organizations that Medicaid contracts with and Medicaid cannot limit the amount of services children receive in the same way they sometimes limit adult services. So on the adult side, they may decide beforehand, okay, no matter what, adults can only get, say, 25 sessions of this kind of behavioral health services in a year. That they don't have that same option with children, because again, with children, they're supposed to be doing aggressively everything they can to do what that child needs to get them on the right track, and we don't know what that would be. So they can't limit services in the same way that they do for adults. Also, this letter makes it clear that it's Medicaid, and when we're saying Medicaid, we mean the state division of Medicaid, which is under the governor's office in Mississippi. So it is Medicaid's job, and this letter makes this clear, to make sure the people who work for Medicaid, so that means if you're someone who's called your county office, or let's say your child is on the disabled child living at home waiver, and that's one that goes to the state office and you've called there, that Medicaid needs to make sure that those people who are working for Medicaid and the people who treat children on Medicaid, so if your provider accepts Medicaid, understand and follow the rules about children's Medicaid. So that's the state division of Medicaid's responsibility. So if you're noticing that people who are working with you don't understand those rules or don't understand how all this is supposed to work, that means that the state division of Medicaid needs to be aware of that so they can do a better job of helping those groups. And then Medicaid's contracts, and again, this may be more relevant to some of the providers on here, with managed care organizations should require managed care organizations to individualize services to what children need. So if a managed care organization, and that's like Molina, United Healthcare, Magnolia, forget who else in Mississippi, and now there's some new ones that are going to come on board. They can't just say, oh, your child has this disability, we're going to give them these services. It has to be individualized to what that child needs. Medicaid is responsible for doing everything they can to make sure there's enough providers and to make sure those providers are helping the children they see. Now, one thing families will tell us is there's providers they want to take their children to who don't accept Medicaid. So what this letter says is then it's the responsibility of the Division of Medicaid to work with providers, including those who currently don't want to take Medicaid, and figure out what can we do to make it more appealing for more providers to accept Medicaid so that more children can get more help from more providers. Medicaid should maximize the use of telehealth. Let's just say you have a child who has a really specific kind of disability or special healthcare need, and there's not a lot of specialists that treat that, but there's somebody, say, in a nearby state who does, and your child could get help from that person through telehealth. Right now, that's not allowed in Mississippi. So looking at what we can do to make sure telehealth is used as broadly as possible to help children. And of course, there's still it we still want to make sure that the quality of that telehealth is good. So there has to be some regulation and that type of thing and oversight, but to not limit what's available to children just by saying like you can't have telehealth with anyone outside the state. To start looking at some of those things and saying, are there ways we could use those things more to be able to meet the needs of children and still be able to make sure it's done the way it should be. And then this includes intraprofessional consultation. And that sounds like a big fancy term, but what that means is if there's a specialist that Medicaid will allow that specialist to help, say, a primary care doctor or a primary care provider, nurse practitioner, whoever, who's treating a child. So the best example we have with that in Mississippi, or the one that I know about, is the CHAMP project. So that's a project where any primary care provider, so a pediatrician, a family doctor, a nurse practitioner, can call there. And if they have a child they're seeing in their practice who has a mental health need, they can call CHAMP and get a free consultation from the doctor, from a child psychiatrist or a child psychologist, and say, how can I best help this child? And that helps that child get care in their medical home without having to be referred out somewhere. And what this letter says is that the Division of Medicaid should look at paying the doctors and the professionals who are providing that kind of help to other doctors. And right now, there's not a lot of that in Mississippi. So looking at how to maximize that. And then Medicaid should use creative strategies to attract and pay qualified professionals. And the letter gives quite a few recommendations about that. Medicaid should make sure it's meeting the needs of children with special health care needs, including these areas. And these are probably relevant to a lot of this a lot of us on this call. A wide array of effective community-based services for mental health and substance use. Not just providing those services, but what's really going to help children stay in the community. And Children's Medicaid gives a lot of flexibility about what that could look like. It doesn't have to be just the services that Medicaid currently says it offers. If there are other services that would help children, there are ways to pay for that through Medicaid. This is also a biggie. It emphasizes, and this goes along with what we just talked about, that instead of a child psychiatrist or a child psychologist seeing every child who has a mental health challenge, supporting children with mild to moderate behavioral health needs in primary care. So giving their nurse practitioner, their pediatrician, their family doctor enough support, maybe through programs like CHAMP and other ways to train them and support them so they don't have to always be referred to a mental health center or a mental health provider, that they can get that help where they're already getting all their other medical health care. And that might mean that that practice hires a mental health professional. They may do consultation. But those children, unless they have really, really significant mental health needs, not being referred out somewhere else. And, it used to really be the practice every time a child had a mental health problem to refer them out to some mental health agency. But the thinking on that is really changing. And I forgot to say one thing on this one before. As far as the wide array of community-based services for mental health and substance use, there's a lot of emphasis in this letter about limiting inpatient care, including residential treatment facilities, unless it is absolutely necessary. So that's referrals to acute psychiatric care and residential treatment facilities. And that's something that we'll see coming up in all three of these things we're going to look at. Some of these things are repeated. So then this letter also emphasizes that there should be a single point of entry into the system for children with complex needs. Now, we do know in the mental health system, in state law, that single point of entry is supposed to be the MAP teams. That's not consistently happening, but that is what's currently in state law. So that's something we at Families as Allies really think we need to keep that as a focus and really work towards those MAP teams being the single point of entry and not all this stuff that happens now with people calling everywhere trying to find help for kids. And if that's not going to work, then go back and change the law. And that goes along with having a seamless and coordinated system of care, which is another recommendation. This letter emphasizes and gives a lot of strategies, Medicaid strategies for improving services for children in foster care and those leaving foster care, and also improving services for children with special healthcare needs and disabilities, including with support to their families for non-medical services, because a lot of times it's those services that families most need and have the most trouble finding, and supporting families with that navigation across systems. Now that's boiling down a 57-page letter, but those are the highlights of that letter and what the federal government is encouraging state Medicaid agencies to focus on. So any thoughts or comments about those? Okay. And Judge Hicks shared with us, this is what I would like more assistance in facilitating, working through the MAP team, particularly in light of change in law that allows youth court to do court-ordered commitments. Okay. Did you want to comment on that anymore, Judge Hicks? I don't even know if you're still on here. And we'll put, could some of our families as allies look up the consultation number for the CHAMP project and put it in there? Put it in the chat. Okay. Yeah. So I think there's a real opportunity, Henry's on here and he coordinates the MAP team, like to really look at in Hinds County what that would look like for that MAP team. And I think it's getting closer. And I know Henry's worked really hard on that single point of entry, but what would that look like for like a child coming before the youth court? And I know you, Judge Hicks, that person is in your care. And you're responsible for them. You don't want to just say, well, here go the MAP team, what that, and that's it. So Henry, do you have any thoughts about that, of what that could look like?
Uh, no, but I'm excited that Judge Hicks is on board with us exploring that a little bit deeper.
Yeah, because I think, and I don't know if anybody else here is on a MAP team or has any thoughts about that. MAP teams they're called informally making a plan teams. In law, they're multi-assessment planning teams, and they're supposed to be that organization where a family can go when their child is about ready to come out of the home to get the services and supports they need. And that MAP team work with them to put a plan together. And what would that look like? And most of them have the mental health providers in that area. And I think one of the most important things, because another thing that law says that identifies MAP teams as a single point of entry, is that wraparound care coordination is the care coordination model for Mississippi. So I think one thing to look at is finding out through that MAP team which organizations are providing wraparound care, and that family being able to pick a wraparound care coordinator from whatever organization they want, who can then help them put together the services that they want for their child and that child wants. And if that wraparound care is really done in a conflict-free way, where that wraparound care coordinator is not being pressured to just refer to their own organization, but helping that family get services from wherever they want, then that family, that wraparound team, and that wraparound care coordinator can keep evaluating And then youth court would be part of the wraparound team to see if that's actually working and then to change services if something's not working or if it looks like the child's going to come out of the home. So those are just some initial thoughts. Yeah. And yes, MAP teams can work for young children too. And yeah. Oh, and yeah, Henry put that in chat. So I just think there's some real possibilities here. And we'll see other things on these other ones that these other recommendations that relate to some of this too. As far as ways to give feedback to the Division of Medicaid, it can be a little tricky. It's sort of a complicated system, but I'm going to tell you about one way. And I thought this would have already happened by now, but it hasn't because the Division of Medicaid their executive director just changed. So they're taking a little bit more time with this. But I did want to tell you all there is an Medicaid Advisory Committee that advises the Division of Medicaid about programs, services, and the federal government has also changed the rules on that and has put a lot more emphasis on, if this is relevant to any of you all, Medicaid beneficiaries. So people who are on Medicaid, either they're on it themselves or their child's on it, having a big role in advising Medicaid about what's going on. So that committee, there's a Medicaid Advisory Committee that meets 4 times a year, and it has not yet met this year because it just got reorganized, and I happen to be on it. That advises Medicaid, and it's advised by a beneficiary advisory group that is just now getting organized too. If you are a Medicaid beneficiary who wants to be on that beneficiary advisory group that's like telling Medicaid and that other committee, this is what needs to happen, we will be putting information out about that in our newsletter. Also, I anticipate that Medicaid Advisory Committee, and I know I'm using a lot of words, should meet within the next couple of months. Watch our newsletter, watch our Facebook page. That meeting should have like a public link so you can attend it either virtually or in person. And I don't know if the first one will, but going forward, I hope all of those meetings will include public comments. So you all can be thinking about these things. And that is one mechanism to give feedback to Medicaid. Like if any of these things are making you think, well, this needs to happen. So through that Medicaid Advisory Committee process. So either by submitting public comments or considering being on that beneficiary advisory group once it gets established. Okay. All right. So that's what we're going to share with you about Medicaid. And I'm going to try, and this is actually, you're seeing where I blog and the stuff that's going to be in a blog. I'm going to try going back. Okay, I can't find. Sorry. I'm going to stop sharing for a minute. Okay, we're going to switch. This is another policy thing we're going to talk about. There's this Mississippi K through 12, so kindergarten through 12 and post-secondary mental health task force. And that was a group of this came out of legislation, a group of people that were put together, and I happen to be on this committee too, so I can tell you a little bit about from that perspective. But there was like principals on there, teachers, counselors, mental health people, probably not as enough families as should have been, but it was a start. There was school psychologists, school counselor, mental health providers. And these are recommendations they came up with. And this was part of the last legislative session. So in January through April 2024, to so it was established in that session, and then the legislation passed to establish it, and then it met over the summer. And these are the recommendations that it came up with, and it's supposed to come up with recommendations for laws about mental health in schools that should be looked at for this coming year. And this report goes over the task force, how it came to be, the different people who spoke to it, who's on it, and then what their recommendations are. And what they were charged with doing. And I'm going to go to the actual recommendations. Sorry, it takes a little while to get there. Okay, so here's the recommendations. So the first part really focuses on a lot about school resource officers. So provide that the school safety grant program, which is something that's already in law, may fund mentoring or other community-based police programs formed in partnership between school districts and local law enforcement. And so there was, DeSoto County has this really strong program, and I think it's the sheriff's department there, partners with the school district, and they have a lot of deputies and officers that are in the schools as mentors. So that was really, there was a lot of interest in could that be expanded to other areas. So that's just something to think about. Then there was a lot of emphasis on mental health screening and other ways to pay for this mentoring or community-based policing programs. And this probably already should have been in law, but wasn't. Require all school districts to adopt and implement a policy addressing sexual abuse of children. Then a pilot program to help children to implement evidence-based curriculum to help students with skills to manage stress and anxiety. This allows school districts and local law enforcement agencies within the school district's territory to enter into a memorandum of understanding requiring law enforcement agencies to conduct an annual inspection and threat assessment of each school. Expand funding for the Mississippi community-oriented policing services in schools. So a lot of emphasis on law enforcement in schools, which continues throughout this. And then require school districts to appoint key personnel or navigators to a coordinating council to oversee a risk assessment program. And what we would bring your attention to is one of the things we see very, very often at Families as Allies is the first thing that happens when the words risk assessment come up is a school calling a family and saying you have to take your child somewhere and get them assessed. And we know, and that you can't bring them back until you do. We do know, just because we know it as families, but also this has definitely been supported at the federal level, that doing that to a family and doing that to a child, if they have a disability, which they often do, and it may not have been identified yet, is segregating them, and that all of that needs to be done in a way where it's coordinated with their IEP or 504 plan, if they have one, or their help to get that if they don't. Okay. So here's some more things about how school resource officers should be trained and about them serving as mentors. So I'm just gonna stop there for a minute and see, this section has a lot of emphasis on school resource officers. Does anybody have any thoughts or feedback about that? Um, in general, and this is something everybody can make up their own mind about. There can be concerns about having a lot of reliance on law enforcement in the school setting, because first of all, that's not their primary purpose. And some youth have had negative experiences with law enforcement, and that may not be someone they trust. That doesn't mean they shouldn't be used, but it's probably a reason to be very thoughtful about how they should be used or the best ways to use them. So that's probably something we as an organization will be thinking about, but I also realize families who are part of us or families who are not part of us can have a wide range of perspectives on that. But that's something that we just think would be good to keep in mind. Okay, so here's some other things. This is probably going to be recommendation number 3 is probably going to be the biggie coming out of this task force. And this is the thing in here, just from being on the task force, that I think is most likely to be introduced into legislation this year. Or in January, once January 2025 gets here and the next legislative session starts. Mandate, so they'll have to do it, all school districts to implement policies prohibiting the use of social media, cell phones, smartwatches, and other technology unrelated to classroom learning during classroom instruction. Allow school districts local autonomy to decide how to implement such policies. So basically, banning cell phones and other access to social media platforms or the internet, other than what's allowed, for doing assignments and stuff during classroom learning time. And that every district will have to come up with a policy that does that. So any thoughts on that? Does that strike anybody any kind of way? There is a fair bit of data out there that shows a correlation between cell phone use and using, and that cell phone use, or access to social media and all that, has a negative correlation with learning. That seems pretty apparent. It's a correlation. We don't know if one causes the other, and also that it can be very stressful for mental health too. So there's probably good reason to consider this policy. What we will probably be stressing, and that I already began stressing on this committee, is that as districts start developing these policies, if this becomes law, that they make sure families are at the table and they're getting input from families about how to do this. Because what does that mean? Does that just mean, your child keeps their cell phone at home, they don't bring it to school, but then, are they going to get a backup phone, these burner phones, all this kind of stuff? What does that really mean? What does that really look like? And what are families' concerns, both that support this type of approach or don't support this type of approach. Because some families have expressed, they want to know that their child's safe at school, and that they feel like they need to have their phone to do that. So having everyone at the table to discuss those things. And also for some children with disabilities, and this is one thing we've already pressed on and gotten positive feedback from on legislators. It might be a reasonable accommodation for them to have their phone at school. That might help them communicate. That might be, they may have an iPad for communication device. You're obviously not going to take that away from them. So to make sure that any law that is created takes into account the needs of students with disabilities so that those needs can still be accommodated. And I think if they do this, they're probably going to model it on a law that passed in Louisiana, and that one does specifically address disabilities. But I think this is probably the most likely thing out of all this that we'll see this coming session. So thoughts, comments? Then prohibit canceling recess time for students in K through 5 as punishment. And then they were talking about, there's all these resources out there and nobody knows what's where and all that. So to require the Mississippi Department of Education to work with the Mississippi Department of Mental Health to evaluate mental health resources and infrastructure when a school or district is taken over by the state, so like an achievement school district, and seeing what kind of resources and people can be brought together to help with mental health support in those districts. Then mandate mental health first aid training for teachers and administrators. Then require the Mississippi Department of Mental Health to review and update school district policies, training curriculum, and other resources related to suicide prevention required for school district personnel. And then all 6th and 9th grade students, as part of their initial orientation to middle school and high school, receive an orientation with other students, like in assemblies, about support services that have to do with mental health, like career coaches. Where can you go? What can you do if you're having mental health struggles? So that they're all exposed to that information, but they don't have to come out and ask for it. And that the Mississippi Department of Mental Health and Mississippi Department of Education will work together to develop information and materials to distribute at these orientations. And this is saying recommendation 9 is about these same types of things occurring at the community college level. And that all of these groups will work together to look at what's the best and appropriate way to screen youth for mental health challenges. What we would say is school counselors already are in a role and qualified, are probably the most qualified people to do that. So when I was on this, as part of our work on this task force, we really emphasized making sure counselors have the support they need. And then requiring school districts, community colleges, and public universities to partner with community mental health centers and their crisis intervention teams or private providers to make sure mental health resources are available to students. And looking at peer-to-peer programs where students can help each other with mental health challenges. And that the Mississippi Department of Mental Health and the Mississippi Department of Education will submit a report to the legislature within a year, looking at all the programs aimed at improving child and adolescent mental health in the state that are supported by state funds, to make sure they're all coordinated and being used in the most efficient and effective way. Because there's a lot of different things going on, but they're not necessarily coordinated with each other. And that there should be an internet-based mental health resource guide at the state level and school district level, and somebody designated to maintain that resource guide. And that I like this, mandate each individual school and school district to place a visible mental health resource button on the homepage of their website. So someone can go to that and just click on it and find state level resources and local resources. Require future ID cards for students, for middle and high school middle school and high school students to include 988 on there. That's the number. It's like the 911 for mental health that you can call 988 and get support with a mental health crisis. Then encouraging schools, community colleges, and universities to plan for space within currently existing structures so that there is room to provide mental health support. And then to add school psychologists to the list of professionals who receive a $6,000 salary supplement for doing that work, to encourage more school psychologists, and also to do some things with loan repayments for different mental health providers to make it more likely that they will work in the state and work in the schools. And then require, number 20, require the Mississippi Department of Education to set staggered goals aimed at increasing the number of school counselors and school psychologists, because schools do not have enough of those two groups of people. And those are the ones who are most qualified and have special expertise in how do you set up schools so that children's mental health is supported. And this is one thing I really liked. It's continued the work of this task force. This was a tremendous amount of work to do in one setting. So this task force, a lot of times it gets dissolved. Like, okay, they did this report, they're done. But what this, and this is my favorite recommendation on here, it says we're going to keep this work going at least until in the next legislative session. So that means that you can talk to people on this task force. You can come to meetings. All of these meetings are open. Again, we will have those on our website, in the newsletter, on our website, on Facebook. You can come to the meetings virtually or in person. This last go round, there was an email, and I don't know if it will be the same email where you could send recommendations. So you can talk to the task force, you can attend those meetings. You can also be watching this, because I can almost guarantee you there will be legislation coming out of this session, at least about cell phone use from these recommendations. So you can then talk to your legislators about that. And we're going to talk about how to find your legislators in just a minute. But I'm going to stop here. I'm going to stop sharing. And do you guys have any thoughts or feedback about any of those recommendations? Oh, and I'm glad. Yeah, that is a good idea about the IDs. Are you guys getting overwhelmed with policy stuff, or is everybody hanging in there? Okay.
Joy, are they leaning toward, as far as the cell phone policy, to districts? Because a lot of districts do have pretty strict policy as far as not being able to access them at certain times, but is what they're talking about more along the lines of finding ways to ensure that children don't even have access to them, period? Like they don't want them to bring them into school.
And that is such a good question, because, it's one thing to say, okay, there, you have to develop a policy that does this, but what exactly does that look like district by district? And there's one district I think that is already doing it where, like, the kids come in and their phone goes in a lockbox and they get it back at the end of the school day. So will it look like that? That's one thing that came up on this task force, and that's come up in other states when they've looked at this, is what does that mean? And I think that's one reason why they're putting it back at the district level and saying you have to come up with something that limits cell phone, that does not allow cell phone use during instructional time. But what that looks like in your district may be different than another district. So that's what I saw. And I think that's one reason why it's going to be important for families to be watching for this and at their local level, working with the school board, and then also talking to your legislator. And I want to check one thing on. So does that help, Nikki?
It does. I was just curious because I know as far as you know, in my daughter's district, they already have a pretty strict cell phone policy as far as what the consequences are if you're caught with it, but you're not supposed to have it out. But they do know that children have them. But it seems, I mean, I know they need to do something, but even in the case of talking about locking the phones up, that seems like, I mean, is it everybody's going in the same box? And I mean, what
I
if somebody
know.
takes the wrong one, or are you
I
getting
know.
boxes for everybody? That seems like really time consuming and not very cost effective. But and are you gonna scan them to see if they put it in the box or they didn't come with one? I don't know. It's just so many
Yeah,
questions.
it's a lot. That's why we all need to be thinking about it. And I want to show y'all something. So you want to be watching for your at the district level and like looking at what your school board, going to school board meetings, seeing if this is on the agenda, and whatever's right for your family and what's right for you may be totally different than someone else. We're not saying what the right thing is. We're saying be at the table because your family's and you know what's best for your family. So you might be thinking, well, how in the world do I even find out who I go talk to? One is watch your local school board when those meetings are. That should be published on the homepage of your school district, and you can watch those meetings. They should publish their agendas. Be watching for this because you can give really valuable. You can also talk to your legislator and your state legislator and legislators. And you might be like, well, I don't know who they are. And that's okay. You can go to this place called Plural Policy. Let's go there. All right. And see this search, find your legislators. We're going to pretend like I live at where I work. And I put my okay, I'm going to have to put Jackson, Mississippi. So I'll put that in there. All right. So this is, and the first thing that's going to come up is my state legislators. Now, this is a state issue. Your federal legislators are who your legislators are, like at the United States level. This is a state issue. So I want to talk to my state people. So this comes up and I see that my state and upper chamber, that's just a fancy way of saying the state Senate. And then the lower chamber is my representative. Everybody has a state senator. Everybody has a state representative. So I find out my state senator is David Blunt and my state representative is Earl Banks. Then what I can do, I can go up here. Let's just remember David Blunt. They're both important, but let's say Mississippi State Legislature. Oh, whoops. Let me do it again. I'm sorry, guys. Let's Google Mississippi State Legislature. And you can see I've Googled it before and spelled it wrong. Okay, home, Mississippi State Legislature. Okay, we want to find David Blunt. We're going to go to our legislators. Oh, this is messing up. Okay, he's a senator. We're going to go there and we're going to look him up, David Blunt. Okay, so there's his picture. So if I go up to the Capitol, I know what he looks like. But this is the most important thing, is his contact information. So this is his number at the Capitol. Some of them will have like their work number too, and then his email. So I can get a hold of him. I can call this number. I can email him and say, I want to talk to you about, I know this cell phone policy thing is probably going to be something the legislature is going to talk about. And I want you to know what I think, because you're my state senator. And then I can do that with a state representative too. That's what I would start doing now if you have an interest in this, because we don't know who's gonna introduce what. And once the session starts, we give families a lot of feedback if you want it about different people you can call and contact with different legislation if you have an opinion on it. But right now, we don't know what's going to happen. But this is someone I vote. And this is someone who knows I might vote for him or I might vote for someone else. So he's going to listen to me probably. And talking to legislators outside the session can be really helpful. So that's what I'd encourage you to do now is find out who your state legislators are. And it really, they may or may not even know that this is going to be an issue, but you can say, you know what, I live in your district. This is something I learned about and it's important to me. And this is what I want you to know that I think about it. Okay, I think we're at the very end of our time and we didn't get to the information on the Committee on Women, Children, and Families. There will be blogs about all of these things in our newsletter Friday, so we will put some of that information in there. I'm so appreciative to all of you for being here. And I'm happy to stay on here, but we are at the end of our time. So I will say thank you, and I'll stop talking here. But if any of you want to stay on or if you have any questions, I'm happy to stay on. Thank you all very, very much. So any questions? Well, I'm so appreciative to you guys. Thank you for being here. And at Family Allies, we always end with go forth and conquer because families standing together and all of us standing together, we can do anything. Thanks, y'all.